জিডি অ্যাসিস্টে আপনাদের সবাইকে আমি ওয়েলকাম করছি। আজকেও একজন ডক্টর আমাদের সাথে আছে এবং আমি কায়নাত আপনাদের সাথে আছি। আজকে যে ডক্টর আমাদের সাথে রয়েছেন তিনি হচ্ছেন ডক্টর বিক্রম কেকাটপুরে, সিটি কেয়ার ক্যান্সার হসপিটাল ব্যাঙ্গালোর থেকে তিনি এসেছেন। তিনি সিনিয়র কনসালটেন্ট, হেড অ্যান্ড নেক সার্জিক্যাল অঙ্কোলজি। ডক্টর, ওয়েলকাম টু বাংলাদেশ।
Thank you very much. It's always a pleasure to be in Bangladesh.
So this is not your first time in Bangladesh, I guess?
No, it is not, and I've been privileged to kind of serve people with oral cancer from Bangladesh for last many years. And as a head and neck cancer surgeon, I had this privilege of treating. So I have a close connect with Bangladesh for last decade and a half. So it's always a pleasure to come back here, meet some of old patients and friends here in Bangladesh. So I truly enjoy coming back to Bangladesh.
Thank you so much. What is actually head and neck cancer?
So head and neck cancer comprises of a group of cancer arising from oral cavity or mouth, larynx, that is voice box, throat. All of them are grouped together as a head and neck cancer group.
Okay. So why does someone get head and neck cancer?
Head and neck cancer is basically a lifestyle related cancer. So head and neck cancer is caused by tobacco chewing, tobacco smoking, and if people are taking alcohol along with it, then it has an additive effect. A small percentage of head and neck cancer is also caused by human papilloma virus or HPV virus, but basically it is a tobacco related, hence a lifestyle related cancer.
Tobacco and lifestyle related, but in our country, and also I visited India, I've been there, I saw people are very used to with smoking. That's their regular habit and they can't actually get it off. So what do you suggest for them actually?
See, look at it. Smoking or tobacco use is not essential for life. We all can survive without tobacco. Societies can flourish without tobacco actually. So tobacco is basically a lifestyle related problem, and we all as a society should fight it out. We all know tobacco causes variety of health hazards. If there is no tobacco, at least 30% of hospital beds would be vacant today. So that is the dimension of tobacco problem. And in India, in Bangladesh, it's a unique problem that people not only smoke tobacco, they chew also. And that is the reason why we have a problem of oral cancer predominantly in our country, because people are just culturally so adapted of putting the tobacco quid in mouth. So people don't look down upon this habit, but it is a bad habit, and that is causing a large proportion of our population to develop oral cancer, which is as high as 30% of all cancers in these two countries are basically oral cancer or head and neck cancer, which is entirely related to tobacco.
Let me translate into Bangla for our who's are watching right now. যেটা উনি বলছে যে ওরাল ক্যান্সার যেটা হয় টোব্যাকোর জন্য, আমরা সবসময় দেখা যায় যে স্মোক করি, আমাদের কাছে মনে হয় যে আমরা উই উইল লুক কুল। বিষয়টা কিন্তু তা না, হয়তো সার্টেন একটা পিরিয়ডের জন্য হয়, তারপর এটা যখনই আমাদের অভ্যাস হয়ে যায় তখনই কিন্তু আমাদের এটা বডিতে ক্ষতি করতে থাকে। এবং ওরাল এবং নেক ক্যান্সারের অন্যতম একটি কারণ হচ্ছে এই টোব্যাকো এবং এই স্মোকিং। এবং সেই সাথে সাথে অনেককে দেখা যায় টোব্যাকোর যে ভেতরে যেটা থাকে সেটাই ওরা একদম মুখে ডিরেক্টলি নিচ্ছে। এটার একটা বাংলা চলিত নাম আছে যেটার নাম গুল বলে থাকি আমরা, সেটা একদম ডিরেক্ট তারা মুখের ভিতর নিয়ে নেয়। এটা খুবই ক্ষতিকর। এই ধরনের প্রোগ্রামগুলো করার একটি কারণ হচ্ছে আমরা চাই যে আমরা সবাই সচেতন হই, আমাদের আশেপাশে যারা এই হ্যাবিটটার সাথে রয়েছে তাদেরকে বলতে চাই যে এই জিনিসটা না করলেও কিন্তু আমরা মোর কুল দেখতে পারি। এনিওয়ে, আমি আবার কোয়েশ্চেনগুলোতে ফিরে যাই। Which are the tests or scanning required for identifying head and neck cancer?
See, oral cancer is one of the easiest cancer to diagnose. because oral cavity is easily accessible, mouth is easily accessible. You just ask somebody to open mouth and you see the cancer. You don't need a sophisticated investigation or test. So what is required is a regular checkup with a dentist or a maxillofacial surgeon or a ENT surgeon. If you are a tobacco user, I would suggest that you should get an annual checkup with a health professional, either a dentist or a ENT surgeon, and get your mouth examined. You really don't need every year. So if there is any white patch or a red patch or any ulcer which has been there for more than 3 weeks, get it examined, and if required, the doctor will suggest for a biopsy.
Okay, and if if they have cancer, and if someone wants to get it off, they want to give up this habit, then what they will do?
So it is always good to give up the habit of smoking, whether you have a cancer or you don't have a cancer. Smoking is a health hazard, undoubtedly. So earlier you quit, it is better. Don't wait for the cancer to develop and stop, right? But once you develop a cancer, then most certainly you should quit, because the chances of curing the cancer are much less if people continue to smoke during treatment and after treatment. So 100% quit at any stage.
So treatment of oral cancer does cause face cosmetic.
So people are always worried whether getting treatment for oral cancer, will they get deformed, whether their face will change, whether they will be able to speak and eat after this treatment. So these concerns are genuine, but now with the improvement in the surgical techniques and reconstruction ability, we have now ability to restore form and function as before. So people should not get worried about the treatment of oral cancer. They will look similar what they were before the treatment. They will have normal speech and swallowing, and that is the ability of reconstructive surgery. So oral cancer is not only just taking the tumor out, but the oral cancer treatment should also have reconstruction elements so that the form and the function is preserved as before.
Okay, so people can go back to their work after oral cancer treatment?
Absolutely. Oral cancer affect in the most productive age group, that is 40s and 50s, when people are most productive in their life, they have responsibility of family and they are contributing to the society. So the current treatment of oral cancer enables us that once the treatment is over, they can get back to society, they can do their normal function activities.
So what should one person maintain lifestyle and recurrence for head and neck cancer?
So lifestyle, as I mentioned, it is 100% lifestyle related disease. You don't need to have tobacco to survive, right? Again, it is also important that tobacco along with alcohol is a very bad combination. So avoid tobacco, avoid alcohol. At the same time, healthy lifestyle is very, very important in prevention. So as good exercise, good eating habit, good hygiene. One of the important factor is oral hygiene. If there are bad and caries tooth, that is another factor which may predispose to cancer. So get a regular dental checkup done. If there are bad teeth, get them treated early.
Bad breathing also?
Bad teeth will give rise to foul smell, and that's the reason that you should see the dentist at regular interval. And if there are bad and caries tooth, which are very common with tobacco user, then you fix that. So that will prevent lot of oral cancers.
So first thing we have to do is give up this habit, which is smoking first.
Absolutely. No doubt about it. So more than giving up the habit, what I suggest is don't take up the habit don't start it.
To look cool.
Absolutely. So that's my message for our college students and school kids. Tobacco is not cool, so don't take it up.
And women also taking it, smoking. They started doing smoking. So people say there are less nicotine in their cigarette for women special. So what do you suggest?
Smoking, whether it has less nicotine or more nicotine, is injurious to health. So don't go by all these marketing gimmicks. All form of tobacco is injurious, and that is the bottom line. So don't get into any of these marketing gimmicks. Special cigarette, looking cool. Don't go after celebrities who come after with smoking advertisement. It is all bad. So don't take up smoking. Avoid the first cigarette.
And as well as alcohol.
Absolutely. So because smoking and alcohol has additive effect, and one thing leads to other in the company of your peers. So avoid the temptation. Don't have the first cigarette. That's the message.
My last question, people occasionally take alcohol, drinking, and also smoking. What about them?
So as the saying goes, first man takes alcohol, and then alcohol takes alcohol, and then alcohol takes man. So it is better not to test the poison. Occasionally also.
Thank you so much for being with us. You have any message to our audience?
My message is again very simple. Oral cancer, which is one of the major health problem in our South Asia, is a totally lifestyle related, preventable, and the most common cause of death in our countries. So let's jointly as a society make a resolution to fight this menace together.
Thank you so much. Thank you, doctor. আমরা যেটা এতক্ষণ ডক্টরের সাথে কথা বলছিলাম, এর আগেও আমি একটু আগেও বলেছি যে স্মোকিং আমাদেরকে মনে হয় যে আমাদের খুব ভালো লাগছে, টেনশনে আছি, এক্সাম সামনে, বস অনেক কষ্ট দিচ্ছে, কি করব, নিচে যে আমরা একটু স্মোক করে আসি। বাট এইটা আমরা করার চেষ্টা না করি, বরং এটা ছেড়ে কিভাবে ভালো উপায়ে বেঁচে থাকা যায়। আমি শিওর এখানে অনেক উপায় আছে। যখনই কারো অভ্যাস হয়ে যায়, সেই অভ্যাসটা ছাড়া আমরা পারি না এমন তো কিছু নেই। সো আমরা এই অভ্যাসটা ছাড়ার চেষ্টা করি। থ্যাংক ইউ সো মাচ এতক্ষণ আমাদের সাথে থাকার জন্য। জিডিএসসি সম্পর্কে বলি, আপনি যদি চান এই ডক্টরের সাথে কনসালটেশনের জন্য অবশ্যই কিন্তু আপনি যোগাযোগ করতে পারেন জিডিএসসিতে। আমি ফোন নাম্বারটি জানিয়ে দিচ্ছি, সেটি হচ্ছে 01617666888। এই নাম্বারে আপনি যোগাযোগ করুন। প্রতি শনিবার আফটারনুনে ডক্টর আমাদের ভিডিও কনসালটেশনের মাধ্যমে আমাদের সাথে জয়েন করেন। তা আপনি এবং আপনার পরিবারের কেউ যদি ইন্টারেস্টেড থাকেন ডক্টরের সাথে কথা বলার জন্য, তাহলে আপনারা আমাদের সাথে যোগাযোগ করুন এবং চলে আসুন আপনাদের প্রিভিয়াস যে রিপোর্টস আছে সেগুলি নিয়ে। আর তখনই আপনি ডক্টরের সাথে কথা বলতে পারবেন ভিডিও কনসালটেশনের মাধ্যমে। ভালো থাকবেন। জিডিএসিস্ট আপনাদের সাথে আছে, ইউর ওয়ান স্টেপ হেলথ কেয়ার সলিউশন।